have been created by the Department of Aging over the last 7 years under the Hogan administration, that are tremendously helpful to our older adults and particularly to caregivers in Maryland. The first is our Community for Life program. And what it does is it brings supports that surround our members that are non-medical, so they can focus on the medical and not have the burden of worrying about home maintenance, transportation. And we also provide a tremendous amount of service navigation so that our members have almost a concierge available to inform them about all the services that are available to them in their own region and jurisdiction. The second program that we have created is the Durable Medical Reuse Program. And I can tell you that this program provides durable medical equipment of all types, from bathroom equipment to walkers and rollators, as well as very sophisticated equipment like hospital beds and motorized wheelchairs and Hoyer lifts to Maryland residents. And we provide it free of charge. And that again can relieve a tremendous burden from caregivers. And I can tell you that you have to see this program to see the magnitude of it. This is not a loan closet. This is a tremendous 60,000 square foot warehouse with locations for pickup and drop off, for donations, as well as distribution in your region across the state. I can tell you that both of these programs are first in the nation. So please take advantage of them. They are available to all Maryland residents, Community for Life, 60 and over. And we want you to be using these programs to make life easier, regardless of the need or the reason for your need. So I've only taken a moment to give you just a brief overview, but our website has details. We have great detail for you, and at the Department of Aging. So please don't hesitate to be in touch with us so that we can share these benefits and services fully with you. Now I have the honor of introducing one of our two division chiefs at the Department of Aging, and that is Liz Woodward. And she is our Director of Long-Term Services. And Liz has worked in the field of aging at all levels since 2009. And she currently works in the department on programs aimed at improving access to information, very important, as well as assistance, and helping Marylanders to avoid unnecessary hospitalizations and relocation to institutional settings. So with that, I want to turn things over to Liz. Thank you all again, and thank you, Liz.
Thank you. I'm going to go ahead and share my screen. Not that way. All right, are you guys seeing my screen?
We are, Liz.
Wonderful. Just gonna reorient this panel down here. Okay. Wonderful. Okay. So thank you so much for having me. Thank you for the introduction. I am excited to be here with you today, and I echo Secretary Kramer in thanking you for what you're doing every day on behalf of Marylanders with dementia and their caregivers. And hopefully we are going to provide some information today that you may or may not know, and that will help in some of that work as well. So I'm here to talk about our state plan on aging. I'm going to give you an overview of the state plan, how it's created, the background of it, and then we'll talk about the goals and then some key objectives that were developed specific to the population of adults with dementia and their caregivers. And then we'll talk a little bit about some of our progress towards that. All right. So the Older Americans Act is really the basis for the development of the state plan. So the Act of 1965, and as it was amended, requires every state unit on aging to submit a state plan on aging to the U.S. Department of Health and Human Services, and now that's the Administration for Community Living is our sub-organization. And that allows us to be eligible to participate in grants to states and to provide programs across our state. The Act also established the aging network that includes our state and local agencies as well. We submit a plan every 4 years. The current plan is for the period of 2022 to 2025. We did get an extension, so hence the slightly shorter period we're seeing there. All right. So just a quick snapshot of our network that's incorporated into the development of the state plan and delivery of services. So at the top, you'll see the Administration for Community Living, which I mentioned is our federal agency. They are our oversight and our funder. So they set the requirements for the report. They also review our report. They approve it, our state plan, sorry. The Maryland Department of Aging acts as that state unit on aging. Every state manages their state unit a little differently. We at the Maryland Department of Aging are an independent organization, and we work closely with our other state agency partners that also do a lot of work that impacts older adults. And some of that work is laid out within our state plan. And we develop our state plan with the engagement of this full network. So you'll see under the Department of Aging, getting down to the local level, we have 19 area agencies on aging, and they are our primary network, our primary agencies that we work with that receive funding through the Older Americans Act and through the department to deliver the services that are outlined in the plan. Each AAA, as we call them, Area Agency on Aging, also develops a 4-year plan, and they submit an annual update on that plan. We use a lot of that information to inform what we're putting into our state plan. Of course, there's a larger network of local providers and volunteers that help to provide services. And so we are also incorporating the work of those organizations. And much of our work relies on partnerships with a range of organizations beyond our 19 area agencies on aging. And then here at the bottom, the floor level, is our target populations, the people we're looking to serve through the work that's outlined and envisioned in our state plan. And that's older adults, caregivers, and adults with disabilities. And then also as part of the development of the state plan, we collect constituent feedback from older adults, caregivers, and persons with disability. We collected over 1,000 responses through our survey process. And we also engaged in 3 town hall events, and we collected comments by email, by phone, and by survey. So hopefully, being wonderful advocates, you guys were able to participate in some of that process. I know we received a lot of really important and helpful comments, especially and specifically around the work outlined related to persons with dementia and their caregivers. So I appreciate, we thank you for anyone who was able to participate in that process and give us your feedback. So this is just the cover, what our state plan on aging looks like. We submitted it last year in October. I'm not sure if these slides will be shared, but we certainly can. And I've linked to the state plan there. It's embedded in our website. And I really encourage folks to take a look at it if you haven't been able to yet. So the vision that is laid out in the state plan is to change the trajectory of aging. So what does that mean? I just want to note, in case anyone can hear my background, I do have a baby. And I apologize if that's distracting for anybody. It is for me, but I will move on. So changing the trajectory of aging, we see it means imagining and launching innovative approaches to accomplishing the goals that are outlined in our plan. So you already heard Secretary Kramer speak about a couple of those programs, that really embody that concept of, our innovative approach. The goals, as you'll see, I'm going to talk about them in a moment. They really focus on supporting independence and health and well-being of older adults, to support them to remain in their homes and communities for as long as possible. So that's important to note. Our department really focuses on that community-based setting. We work really closely with the Department of Health, who does, licensing, regulation, oversight of more institutional settings. And we really focus on serving that community-based setting and building those supports that can help people to age in that setting of their choosing, and avoid institutional stays that they may not want. So we kind of lay out within this plan our innovative services, as well as what we see as the core services of Older Americans Act that are funded through that process. So the core services include the senior nutrition program, for example, which offers home delivered meals and group dining. Over the course of the pandemic, there was a lot of innovation in that program as well, because it was, such an important and high priority need, but could not necessarily be delivered in its traditional setting. So there were also grab and go options that were incorporated, and partnerships with community restaurants as well. Another core Older American Act program is Elder Justice. We partner with legal counsel, other agencies that are focused on identifying and reducing elder abuse. Another core program is health promotion. So you'll see all these things represented within our state plan. Health promotion includes a range of health promotion. It might be a lot of activities that happen in senior centers, as well as some specific evidence-based programs that have really been tested and found to help people to manage chronic disease and improve their health. All right. So I don't need to get into these innovations, but these are some of the key programs that we have. I think what wasn't mentioned on this slide is the senior call check program, which is daily call checks. So you can see from Secretary Kramer's discussion how much each of these have real value in assisting older adults and their caregivers to help people to remain at home across populations. All right, our mission that's identified in the plan is to establish Maryland as an attractive location for all older adults through vibrant communities and supportive services that offer the opportunity to live healthy and meaningful lives. And that's at the core of everything we do. That's really what drives the department's work. Our focus areas here are laid out, and these are the areas that have been used to develop our goals. Elder justice, access to information, health and wellness, aging in place, and partnerships to expand capacity. And here are our goals. So you can see they really draw on those focus areas. The first is to advocate to ensure the rights of older adults and their families and prevent their abuse, neglect, and exploitation. The second is to support and encourage older adults, individuals with disabilities, and their loved ones to easily access and make informed choices about services that support them in their home and community. As Secretary Kramer mentioned, this is where I live, is in this goal. So you'll see a lot in there about our Maryland Access Point information, referral and assistance program, and how we're trying to build and innovate around that service. Our third goal is to create opportunities for older adults and their families to lead active and healthy lives. The fourth is to finance and coordinate high quality services that support individuals with long-term needs in a home or community setting. And the fifth is to lead efforts to strengthen service delivery and capacity by engaging community partners to increase and leverage resources. So as you can see, these goals overlap with each other a lot. They rely on each other a lot. And all of them are relevant for persons living with Alzheimer's disease and related dementia, and also their caregivers to be able to have the healthiest, most optimal situation. But I did also pull out a couple of our goals that are more focused specifically on this target population of adults with dementia and their caregivers. I thought those might be of interest to that group, to this group, sorry. And they're really around this goal too, supporting and encouraging older adults and individuals to make informed choices. That person-centered planning and informed decision-making is really core to Maryland Access Point and so much of what the department is doing. So I'm gonna talk you through a couple of those objectives. So the first one I pulled out is objective 2.2 that you'll see in the report, to establish the Maryland Family Caregiver Support Program as a focal point to expand dementia education statewide and to improve awareness and use of resources that build dementia-friendly communities. I'm sure a lot of you are very aware of the concept of dementia-friendly communities and many of the aspects that go into that. This program, the Maryland Family Caregiver Support, is one of those core programs that does receive funding through the Older Americans Act. It's a key support service that we offer for caregivers, provides an opportunity to address the needs of those caring for loved ones with dementia. So some of the strategies that are included in there are creating a dementia-focused webinar series to train stakeholders in our aging network, to work very collaboratively with the Alzheimer's Association and other partners, and especially with the Maryland's Virginia I. Jones Alzheimer's Disease and Related Disorders Council. We are represented on the council and we part-time staff it, and there's been a lot of really wonderful work done there to plan and envision statewide activities to target this population. And in doing so, to increase awareness and use of resources and training opportunities across populations. And then we also have a strategy around hosting and sharing sessions to advance the use of state and local dementia-friendly practices, really building on the local knowledge and activities and best practices that have been developed, and looking at that statewide. We do have some measurable outcomes. So I mentioned every goal has objectives, strategies to achieve those objectives, and measurable outcomes. So for example, in this one, we want to increase the exposure to dementia resources and training opportunities through the number of targeted dementia email alerts sent to AAAs and stakeholders by 10% each year. So we've got a number, we've got a strategy that we want to achieve, and really looking at how we can, what kind of impact we might be able to have. So another example here for measurable outcomes, increasing the number of stakeholders outside the AAA coordination network participating in webinars by 20% over 4 years. So really understanding that level of local providers is so much wider than just our area agencies on aging, and making sure that we're reaching them as well. I also pulled out objective 2.4. This one is around sustainably embedding dementia-informed home and community-based services staff, partners, and referral systems in Maryland's No Wrong Door system through this ACL grant. So David very kindly mentioned our Maryland's Dementia Capable Community Project, which is funded by the Administration for Community Living. We partner closely with the Alzheimer's Association and several other organizations on that grant, and that's really a focus area for this objective. So some of the strategies include reviewing intake and triage and enrollment systems to ensure that there are adequate opportunities and tools for our staff to identify individuals with dementia and their needs, to provide training resources and technical assistance for MAP and other statewide home and community-based services providers on how to recognize dementia, how to communicate effectively with persons with dementia, and how to refer to available services effectively. And we also want to, for example, improve the accessibility of our Maryland Access Point website for those with dementia and their caregivers. I'll talk for a moment about what we've been able to do. And then of course we have some measurable outcomes there as well, but I won't get into those because I'm cognizant of the time. So I want to talk a little bit about progress towards those outcomes. In the caregiver services, we're still, really working on that. We're in our first year and trying to sort of reorient and figure out where those resources are, and doing a lot of work with some of the activities that are being engaged with on the health promotion side to encourage programming in senior centers and in other settings. And then in the Maryland's Dementia Capable Community Connections Project, I work on that directly, so I'm able to speak to it. pretty well, and we're really excited about a lot of the work that we've accomplished there so far. So we do have a new Maryland Access Point website that launched last summer, and we're working on getting the word out. We did launch a resource page specific to ADRD in collaboration with the Alzheimer's Association, and I also have embedded the link there. As part of that, we had done a screening of our sites to figure out what types of screening tools do they use. We did a survey of our sites, to figure out what types of screening tools they use, and found that we were kind of missing access to online tools that would be available for people directly and for our network. So we did embed a screening test into our website that can be used directly. We also developed a dementia capability training for aging network professionals. We collaborated closely with the Alzheimer's Association and especially with the Johns Hopkins University Geriatric Workforce Enhancement Program, also with the Mental Health Association of Maryland and other partners too, to develop the content of that. And we delivered it to Maryland Access Point staff. We had 213 professionals that participated in that. We had 149 that completed it and did the post-test and received a certificate of completion, all of those things. So that was a really huge impact. We were really excited about that. We did see an increase in dementia knowledge from our pre to post test. Oh, sorry about that, going forward. And then we've also been working to support the delivery of powerful tools for caregivers and building better caregivers workshops. These are evidence-based programs that have been shown to have an impact on caregiver burden. And we've been working to establish that, strengthen the delivery of that statewide, incorporate data collection statewide. And we've also built and incorporated a sort of session zero that has some content specific to dementia for caregivers that are serving persons with dementia to give them the knowledge they need to put a lot of their the knowledge that will be built on that into context for them and their lives. All right, and so far we've had about 100 caregivers participating in those workshops, and 85% have reported that it was quite or extremely helpful, and the majority have increased their confidence in finding community resources specific to the persons they serve with dementia. So that's just a quick overview of the state plan, a quick overview of some of our work specific to the target population. And I'm very happy to answer any questions you have. I will do my best.
Great. Thank you so much, Liz. Thank you so much, Secretary Kramer. We do have some questions that have come in via the chat and via the Q&A. And I will throw them out there and then welcome your thoughts. And folks are welcome, as I mentioned during the presentation, to please insert any questions that come to your mind in either the chat box, their Q&A, and we'll get to them in order. So first question that comes in is, how do we hear, let me see if I'm reading this correctly. How do people access the durable reuse program? Thank you.
I can cover that one, Liz, I think. Please go to aging.maryland.gov, and I know that's been put into the chat box. Please look us up, look up the program, and then all you have to do is contact our program either through email or phone, and we can give you the information. The director of our program has a PhD in physical therapy and can be very helpful in assisting in determining what it is that you might need, what would work best. And keep in mind that sizing of equipment is also crucial if it's going to work properly. So we are able to assist with that advice when you contact us.
Great. Thank you so much, Secretary Kramer. Next in chat box, Michael writes, I am so impressed. Mary writes, incredible. So glad I joined this call to learn about these free services. Bravo. And we'll go on to the next question. And this was just touched on a little bit, but if there's anything else to add, please feel free. This is from Gary. Can you please give us information, link, phone number, etc., on how to best utilize your services? And this was kind of addressed, but if there's anything else to add, please feel free.
I believe it was addressed by Alzheimer's Association. There is just a wealth of information there. I would also suggest that you contact your local area agency on aging, because they have experts in their information and assistance program, and they can also guide you to whatever might be available through our older adults funding programs. So we have caregiving resources and some respite. It's not nearly enough at all, but we can assist you in finding those things as well.
Great, thank you, Secretary Kramer. Next question for Liz and the Secretary. I did not see Cecil County on the list for equipment. Are they not part of this program?
They are absolutely part of this program. Every town and jurisdiction in the state is part of it. And I can tell you, when we rolled it out initially, we were advised not to do it statewide, to do a pilot, and we would not go that route. We rolled it out to the entire state a year ago. And what we do is we can't have a drop-off center in every single jurisdiction. In some jurisdictions, there were just none to be had. We'll expand eventually, but we have them throughout the state. So if there is not one directly in Cecil County, there is one nearby. So look at our map that's on our website and find a distribution site that is, and drop off, because we're happy to take your donations so that we can continue the program. But there will be one very near your home.
Thank you, Madam Secretary. Next question from Mary. If we wanted updates on all of these programs, do we need to check the web periodically? Or is there a summary update on all of them, quarterly, monthly, etc.?
Let me, if I can, on our programs, we just continuously update our website when we expand programs, when new services come along. So continue to watch our website, I would suggest.
Terrific, thank you. Next question, and we keep going here. My goodness, a lot of questions. This is fantastic with the level of engagement we're getting. Next question is from Kathy. You speak about support for older adults with disabilities and dementia. Is there an age qualification? So presumably that's to the question of folks with early onset dementia. Do they qualify for support as well?
I'm going to let Liz speak to her programs. We do have some age restrictions based on our older Americans funding. The Older Americans Act funding does have some restrictions. So it really varies to some degree based on what program it is. I can tell you our Community for Life program has an age restriction. It starts at age 60 and older we serve. Our Durable Medical Equipment Reuse program is for Marylanders of all ages. Though it is under the Department of Aging, we happily serve young people, pediatrics, and so that there are no restrictions there. And I'll let Liz, and I would suggest just checking with us. And please know that we work very closely with the Department of Disabilities, and they are available as well to cover certain age groups and population that we cannot. Liz, do you have anything you'd like to add to that?
I definitely agree with that. Because so much of our funding comes from Older Americans Act, the definition they have of older adult is 60 and over. So a lot of our services are connected to that definition of aging. But we also are, our Maryland Access Point, which I've referenced a couple of times, is the Aging and Disability Resource Center for the state. So it spans the entire, lifespan. We focus primarily on adults, right? So if somebody needs in-school supports, that's an area where we are more likely to partner closely with the Department of Disabilities through our local sites on that. But a lot of our services do range, and a lot of services are offered locally range as well based on the funding source for those services too. So there is some flexibility, and especially when it comes to our focus on caregivers, because we know people of a range of ages act as a primary caregiver for a loved one.
Great, thank you so much. I'm actually going to chime in with a question of my own and use the discretion of the moderator. And I wanted to ask about, related to the plan. The plan lays out a number of really significant steps for the next few years, 2022 to 2025. At the same time, we are seeing the American Rescue Plan and historic levels of funding flowing to state governments. What has the department heard thus far about how the state plan is going to be affected by ARPA and that funding flowing to state governments, putting us in a situation where that is not traditionally one state governments have, with lots of funding?
You're right, Eric. Thank you. I would like to note that the governor has included in the budget for the Department of Aging an additional $6 million, which is tremendous for us, to enhance our information and assistance programs, which means that our AAAs, if this budget passes as the governor submitted it, our AAAs will be able to hire many, many new staff to answer the phones and to spend more time in giving advice to those that call, as Liz mentioned earlier, through our Maryland Access Point. So it is a tremendous increase in the supports that we'll be able to provide. He has also added, as part of that $6 million, $3 million to our housing supports programs. We don't do housing at the Department of Aging, but we do have some programs that allow us to financially support older adults going into higher levels of care to prevent nursing home admission. So we can help possibly be the difference of $800 or $1,000 a month that would allow someone to remain in assisted living rather than having to move into a nursing home. We also support some older adults who are living in congregate settings. So the funding is being used to do those things. Keep in mind that we have the limitation in the new funds in that we have to create programs that will continue to be sustainable after this new federal money is no longer available. So we have to be very cautious not to leave ourselves in an irresponsible position where the federal funding drops off at the end of the next year and we have to readjust, throw people out of programs. We're not doing that. We're being very careful.
Tremendous. Thank you, Madam Secretary. Next question coming in from Gary. What would you recommend as the best resource for caregivers to talk to people for advice on how to handle day-to-day situations, especially if the caregiver seems to be constantly overwhelmed?
Liz, do you want to take that one? Certainly our Maryland Access Point supports, but please.
Absolutely. Yeah, that's what I was going to say. Our Maryland Access Point service is our, as I mentioned, information referral and assistance services. So when somebody calls into Maryland Access Point, they're able to engage in an assessment, identify what their needs are, what their situation is, what their resources are that they can draw upon, and also what they want. And it's the work of Maryland Access Point that to go through this process, which we call options counseling, right? To understand what your situation is and what options are available to you, and then to kind of help to build a plan on how to address that. And that might be direct referrals and application assistance to sign up for long-term services needs and immediate services that are available. Or it might be looking at other organizations that are available in your community. So much of who that right person is and what that right service is going to depend on where the person lives within the state, and what local resources are available to them, as well as their exact situation. Everybody's in a different situation. So we're really lucky to have that service throughout the state, to be able to concentrate on having those person-centered meetings that can address each individual's specific situation. So you can contact Maryland Access Point. We have a website that's marylandaccesspoint.info, and you'll see all our local agencies. You can also call directly in to our line, which is 1-844-MAP-LINK. We've got a statewide line. They'll provide resources immediately that are available to contact, and then also make a referral into a Maryland Access Point options counselor.
Eric, could I add one thing to that? Do we have time?
Without doubt.
I would like you all to know that something that we were able to start on a number of years ago, pre-pandemic, was what I thought would be a win-win for the community, because our adult medical day providers were coming to me and saying, we have a problem. We are reimbursed only when individuals are filling our chairs every day. And Medicaid, Medicare, they do not reimburse adult medical day providers when someone calls out sick, or when someone comes in, spends 3 hours there and then goes home. The provider gets nothing. Makes it very hard to perform and to remain in business under those circumstances, because regardless of how many people come in, they have their base costs that they have to carry. It seemed to me that we could enhance our respite program across the state dramatically by making those open slots available at a heavily discounted rate to our community members and caregivers who could use respite, and use once a week or once every couple of weeks, or if it just happens once a month, to look to see what adult medical days were available in their community, and to bring their loved one to that location for a good day's activities and care, and give them an opportunity for respite. The pandemic closed down our adult medical day daycare providers, so they weren't able to remain open through a good deal of it. So we were delayed in creating that program. I would love to have the Alzheimer's Association work with us, if there's any interest in renewing that process that would increase our respite capabilities throughout the state dramatically.
Well, Madam Secretary, we have our Greater Maryland Executive Director, David McShay, on the line. So you're speaking to the right audience here. I want to continue with the questions and comments, and we have one from Sue. I'm not going to ask the Secretary and Liz to weigh in on legislation during the purpose of this call, but there's excitement for the bills that the Alzheimer's Association has worked with elected officials and former Senator Kramer, now Secretary Kramer's colleagues in the Maryland State Senate to introduce around dementia caregiving. And we're thrilled that the legislation that Senator Augustine and Speaker Pro Tem Sample Hughes have put forward to create a Director of Dementia Services and Brain Health reporting to Secretary Schrader in the Health Department is moving forward. And we're all excited about that legislation. So thank you for the remark, Sue. I want to move to a question in the Q&A. And that is from Pat. Grimes, who is a home health nurse, and she writes, AERS takes such a long time to get into people's homes. Are there plans to increase accessibility to those needing AERS?
Liz, do you want to? That is a service of the Department of Health. And so I need to separate what is the responsibility of the Department of Aging from that of the Department of Health. So that is a question to ask of Health.
Great, thank you for that distinction, Madam Secretary.
Those assessments.
Next question in the Q&A from Lori Anderson. Is there help when you have a loved one in assisted living with navigating through it financially?
I do not know of any specific financial assistance that may be available if it is the educational piece. I am not aware of that. It does not mean that local jurisdictions don't provide that. They may well. We do not from any of our programming at the state level. I would suggest, though, that our programs that I noted earlier, our assisted living supports program, as well as our congregate housing support program, should be something that's investigated. But that is not a financial education resource.
Thank you for that. Next question is in the chat box. It's from Pat Grimes again, and she writes, thank you so much. I was able to log into the department's website and it loaded very quickly. Next question here. It's from Irma Nicholson. You have, and I guess this is to me, you have given so much valuable information. As a caregiver, is there a way we can get your excellent presentations to us? And Irma, I agree with you. The Secretary and Liz have given such valuable information today. We are going to post this presentation and all of our Advocacy Week presentations, including Stevan Ellis, our long-term care ombudsman, who joined us earlier this week, and our Social Media 101 on the Alzheimer's Association's YouTube channel. We'll email that out to advocates, and we'll also let folks know after the meeting about how to access it. Next question. No, another comment from Kathy. Support groups in the 24/7 helpline that the Alzheimer's Association run is also very helpful to caregivers. I want to throw in a question of my own as we have a few minutes left, and to Secretary and to Liz. As folks have spoken about in different settings, the pandemic exacerbated a lot of issues that were already in our society, and the state plan goes and touches on so many of them. And I think Liz touched on this a little bit when she mentioned the senior call check program. Can you speak to thoughts about how the state plan on aging addresses loneliness? It's something the Surgeon General has spoken about. It's something so many of our seniors are struggling with and continue to struggle with during the pandemic, is isolation and loneliness. Any thoughts about the connection between that and the work of the state plan on aging in the department?
I can start by saying that that has been a very major focus of ours throughout the pandemic. And as Liz can tell you, we have spent untold hours brainstorming about ways to prevent or diminish isolation. And we've watched what's been done throughout the country very closely so that we could learn from one another. We've done many enhanced programs. We have provided home delivered meals in a way that we tried to provide information and connections. Our AAAs did a spectacular job of standing up their online presence for senior center programming. If you look at our senior center programming online, there are museum tours, tours of various countries available, classes, bingo, interactions of all types. We set up a program called Tell Your Life Story that brought people in together to be able to learn how to pass on to their children and grandchildren their life story, so that they create a connection from generation to generation, but also so that they could get together once a week and share and enjoy each other's company. We also, and Liz can speak to this, set up a program funded through a grant from the federal government that allowed us to create the technology or provide the technology necessary to communicate on the internet for older adults who didn't have that before. And I'll ask Liz to talk about that. We've done our Community for Life program, brought those members information and opportunities to get together and to chat with their neighbors, and assisted those who did not have the internet capability in getting that established, so that throughout the pandemic, they could socialize even if they were at home. Liz, do you want to mention the tablet program?
Absolutely, yes. So we had one of our grant supported funding to do some targeted outreach and distribution of internet connected tablets for individuals who were low income, did not have access to a tablet, a computer, a smartphone, did not have internet access, and were experiencing social isolation. So we worked with several agencies to identify folks, get them the resources they need, get them signed up for virtual programming that was available either through virtual senior centers or some of our health promotion programs that were offered online. And we were able to, provide also some additional support. We can't just get something, a new piece of technology, and know exactly how to use it and immediately Skype call our friends or our family members, right? So that was part of our project as well. And we found that having that assistance was so key, and that individuals who had never, come into contact with this technology were able to do so and get connected into these programs that they didn't have access to before. So we're really excited about that. We're still sort of looking through the data and thinking about the implications on how we might utilize that sort of strategy in the future.
You should also know that we established, only state in the nation to do so during the pandemic, a caregiver services corps that we ramped up immediately at the beginning of the pandemic. And what we did was we provided non-medical, to a little degree, medical services to Maryland residents who had been accustomed and dependent upon family caregivers who could no longer come into their home, either because they had been exposed to COVID or had COVID. And we didn't want those individuals having to go into, to call 911 or to go to an emergency room. So we utilized the Maryland Medical Reserve Corps. We developed very quickly a large cohort of volunteers who agreed to be able to go into people's homes to assist an individual in getting in and out of bed, to toileting, showering, dressing, as well as those who just needed someone to help provide a meal. I can also tell you that we had many people who had needed assistance with just picking up around the house, and their family caregiver couldn't get in to do that. So our lovely volunteers did some of that as well. And that we continued for over a year during the pandemic. So it relieved the family of the pressure of not knowing what to do when the family that they cared for would be on their own because they couldn't assist. We got to the point after about a year and a half, things opened up again and our calls became fewer and fewer. And so we terminated the program, but we utilized it tremendously, and it was a huge support for caregivers.
Thank you, Madam Secretary. And my goodness, the questions keep coming in. So out of respect for the Secretary and Liz's time, we are going to have a hard stop right at 11. I'm going to combine the next two questions, which I think can be answered a little bit quickly, so to speak. And the first is from, let's see here, Mary Singer, who asks, how do we find senior centers in Maryland? The second is from Ernestine, who asks, is the tablet program available to sight impaired individuals?
So I did enter in the senior center web page from our website into the chat box, and I encourage folks to look at it. It has information about senior centers and also a list of virtual senior centers with those links and how to access them. So please check it out. In terms of the tablet program, we did have folks participating that were able to access, use the tablets based on the accessibility features there. It's also for folks that weren't able to do that, we also did make referrals to the Maryland Assistive Technology Program, MDTAP, which is a wonderful service offered statewide and has free services. They have a loan process. So I encourage folks to take a look at it. They have a lot of access to devices for people that are hearing impaired, visually impaired, and they do a whole assessment process to help folks figure out what they need, what will work for them.
Terrific. Michael writes, this is all fantastic. Pat Grimes writes, bravo. So I want to close actually with a little bit of a fun question that came in from the Q&A to the Secretary and Liz, and I'll put it as this. Are there opportunities for nursing or physical therapy or medical students to do internships with the Department of Aging and get involved with all this great work and advancing the state plan on aging?
We would love to have people who are enthusiastic about doing what we do come to the Department of Aging. Please do not hesitate to contact us. We have open positions. We love interns. Some of the people in some of our top staff started as interns with us when they were in school. And there are many, Liz, there you go. And who skyrocketed, I must say, to the top of the department. But we very much would love to have and could use services and participation from interns, absolutely. And I can tell you, this is going to be my last opportunity to speak as the secretary to this group on Advocacy Day. I've enjoyed it every time that I have, but I'm leaving with the Hogan administration a year from now. And I can say that this has been the most wonderful experience of my lifetime. It has been so heartwarming to be able to really work towards helping people. And we would be happy to share that experience with you.
My goodness. And on that note, I'll end it with the words of Jenna here on Advocacy Week, who says, thank you so much. Excited to continue to advocate with such exciting information that the Department of Aging is putting forward. So thank you for being part of our Advocacy Week. Thank you for sharing about the state plan on aging, which is policy that it informs all that we do to aid seniors in Maryland. And thank you to the Secretary and to Liz for taking the time. Just really tremendous presentation. Have a great rest of your day. And again, thank you.
Thank you, Eric.
Thank you.